Hi everyone. Um, Myself, Shifali, and Sharat, we would be talking about the challenges in the breastfeeding problems in the modern world. Breastfeeding is considered to be something that comes by natural, and hence it is expected by everyone to come to every mother naturally. But the truth is far from reality. There is just so many different facets regarding breastfeeding that makes it almost an art form that has to be perfected. Some of these phases or facts are how to hold the baby, how to effectively latch, and the breastfeeding techniques. Moreover, it's the mismatch between the expectations and the reality that pushes the mother to stop breastfeeding in the beginning weeks of the postpartum, then that worsens the existing problem. This primary cause leads to the reducing the rate of the breastfeeding as recommended. Some of the top reasons that mothers reported include the cracked nipples, perception of insufficient supply of milk, pain, and fatigue. Overall, the issue has to be dealt from its root cause. For it, the healthcare professional need better awareness and understanding the gravity of the situation. They need to gain further insights into the different factors at play and look at the modifiable risks factors here. This issue has different level to it that ranges from biological, psychological, social factors to make some actual changes. Some solutions presented in order to tackle these issues are increasing awareness of barriers faced by mothers during breastfeeding. This in turn helps the healthcare professionals to detect cases of early stopping of breastfeeding. The pressure of returning to work negatively affected the mothers in many of the researches we done so much that it contributed to stopping of the exclusive breastfeeding. Hence, every employer needs to understand and to be more supportive to allow mothers to balance work and breastfeed the child equivalently. Introduction of policies to help and support breastfeeding mothers is a step in the right direction, and they should create dedicated breastfeeding rooms if they don't have already. So let's understand the concerns for breastfeeding. Another concern was the perception of being limited in its nutritional value, the pain experienced during the breastfeeding. That again resulted in discontinuation of the breastfeeding milk for the child. All of these issues can be associated with lack of knowledge and use of improper techniques while breastfeeding. All that is required in imparting of proper knowledge and guidance to the mothers to eliminate these issues. This will lead to automatically increased maternal confidence while breastfeeding, which is turn result in making the mother to gain more insight in process of breastfeeding. Depression is also reported in mothers in the postnatal period that have the physical pain during the breastfeeding. Hence, emotional support in another form that is of primary importance for mothers when going through this time. Um, Continued professional support in the communities to make um, much needed changes in the attitude and the behavior to support the breastfeeding. Let's talk about the planning the goals to support the breastfeeding. So we have three types of goals here: the short, medium, and the long. So the short term goal is looked after for 1 to 2 years. The short-term goal that I intended with the health promotion plan are to increase awareness and information among the general population, further including the future parents and the society. The goal is to get the acknowledgement from the government officials and the public health officials of all the existing problem. This could be done in a span of 1 to 2 years to achieve the goal. The government officials um, would automatically point out or make it ineffective of the project, trying to spread the awareness. And it can be observed if the government is funding to promote the breastfeeding, uh, promoting to make an effort to implement the breastfeeding programs to support women facing different types of issues with while breastfeeding. Failure to see the changes points to the fact that the health promotion plan was failed and failed to make an impression. Along this line, the companies can too show that support and spread the awareness about issues by making new policies that are more receptive and supportive of new parent. Um, Transition time for new parents are crucial time, and as mentioned earlier, support of various forms during this time are effective. The medium and the long term goal and the implementation of the health promotion policies and the various steps involved will be discussed by Sharat.
Hi guys, my name is Sharat. I'll be covering the rest of the presentations. So I'll be picking it back up from medium-term goals. So these are goals that have to be realized from 3 to 4 years. These are changes that we would expect to see after 3 to 4 years. A high percentage of parents that are now interested to learn about proper technique for breastfeeding. This is an indication that the health promotion plan is getting traction. Proper intervention and timely dispersion of information will reduce margins of error and improve maternal confidence to a great extent. So this change is expected to be seen after 3 to 4 years after the launch of public health model. If parents still remain aloof of all the services and educational courses they can avail for learning about breastfeeding, then it can be concluded that this health promotion plan was not as effective as should have been. So in order to get this information, what you could do is you could conduct surveys or questionnaires. You could do a review analysis, of scientific literature. So these are different ways you could really point out, or maybe or collect information to see if there's been an increase in the numbers of parents reaching out for help. Next goal would be that the government is expected to set up facilities and different services that could be used by pregnant women. Easy accessibility is also expected at the time of introduction of these new changes. So existence of no such service and facilities is an indication of its failure. So this again can be conducted through, you could probably set up a body that could review these policies and see if the facilities that are there, if it's been set up, if it's been working properly, if it's easily accessible, if the parents are happy with the services. So this is again something that you would see in about 3 to 4 years. That would take shape in 3 to 4 years. Now another medium goal that is to be achieved is successful debunking of misinformation and myths around breastfeeding. So all the awareness and communication channels used by this point should help in achieving this goal in no time. So in order to realize this goal, you could probably conduct surveys and questionnaires and see the quality of questions that's coming in. If you have myths and misinformation that's coming in, that probably tells you that the health promotion plan wasn't successful. Another medium-term goal would be that the companies are willing to support new parents by introducing policies and programs to remove different types of obstacles. Absence in these policies could possibly indicate failure of the promotion plan. Again, a survey could be conducted. You could do a review analysis of all the recent changes that have been made in the company in the past 3 to 4 years. If they're supportive of parents or pregnant women in general, you probably do a review analysis. That'll tell you if it's a success or not. Moving on is your long-term goals. So these have to be realized from 5 years to above. So if the short and medium term goals are finally achieved, the most important milestone will be increase in the percentage of women opting for breastfeeding. This should lead to increased number of months of breastfeeding too. This goal ideally should be realized in about 5 years and above. So no change or decrease in the percentage of women opting for breastfeeding is a result of unsuccessful implementation of the health promotion plan. Survey could also be used to collect different data points to chart the growth of this health promotion plan. If minor problems are detected early on during the implementation of the promotion plan, they can be rectified to deliver better results. So yes, you can collect different data points, and on the basis of the data points, you can probably chart it and see the differences that it has made in the lives of, pregnant or lactating women. Another long-term goal is to realize increase would be to see increased support from society and family members to opt and continue breastfeeding beyond 6 months. So this change may be seen being adopted at different times for different families, depending on the cultural and family values. Mm, Another long-term goal that we would like to see being achieved is anticipation of problems that the parents could possibly face in the future at the time of breastfeeding is a good sign of successful promotion plan. So what this does is that the parents already know the necessary interventions that they need to correct their mistakes and ensure safe breastfeeding is practiced. What this point is about is about seeing if the parents are aware of the common problems that exist during breastfeeding, even before the actual time of breastfeeding. So this point can be connected back to the awareness and the knowledge that's required at the time when the woman is pregnant, right? Just before the breastfeeding phase starts. So these are the long-term goals that we would like to see be achieved. Uh, Moving on, we have the steps involved in implementing the health promotion plan. So these have been divided into 3 different steps. This first step being involved is implementation of the promotion plan that can collect all the necessary data available across the globe on this issue. So a lot of research work with respect to this topic has been conducted and reported. Government agencies should determine the best source of relevant research work with relation to the population demographics. Once all the data and statistics have been collected and collated, they can be put to use. A budget has to be allocated for promoting breastfeeding practices. The funds will be mainly used if the research is required around the topic. Can be used for advertisements and different means of spreading awareness. So a team can be commissioned to overlook the use of funds spent on advertisements. Further down the line, the funds can also be used to develop training materials and resources for health officials. Another team can also be commissioned consisting of various stakeholders for this health promotion plan. The team could include government officials, health practitioners, public health officials, Ministry of Labour officials, company officials, and any other official that will help the cause. Next, we have the second step, where the final decisions taken by the respective teams regarding training materials, advertisements are put in place. Policies and programs should be in place by the government in support of lactating pregnant women. This could be in terms of setting up hotline or other forms of contact with trained health practitioners. Government could also provide some sort of incentive to companies that adopt policies in favor of breastfeeding women. They could also make mandatory rules regarding setting up comfortable lactating rooms in every company. In terms of advertisement, social media could effectively be used to create interesting ads to deliver the message. A Netflix documentary could also be produced that could go into lengths about the risk of current levels of breastfeeding percentage. School curriculum could also be possibly changed to teach adolescents about the importance of breastfeeding. Next step could be tapping into traditional methods of communication, including billboards, newspapers, or brochures explaining the importance of breastfeeding. A combination of all these communication channels should draw everyone's much needed attention to this issue. If any material is not generating the required amount of traction, provision should be made to go back and make changes to deliver the message more efficiently. Feedback using surveys and using different ratings should be collected in regular intervals to understand the pulse of the population. Advertisement message should be tailored according to the audience and end consumer's requirement. Training materials and resources should also be updated in regular intervals to give the most accurate data available. These are being the second step of the implementation. We move on to the third one, which would include assessing the program of the promotion plan. All the feedback and changes directly or indirectly resulting from the promotion plan evaluated. The policies or program that is deemed effective are allowed to continue with budget being regularly allocated. The ones that aren't providing the desired levels of engagement will be scrapped and funds will be diverted for other use. This way, bad policies and programs will be weeded out when not functioning like they should. This will result in better use of money, Other changes that should be the outcome of the outreach would be change in societal perception of breastfeeding. We would like to see more support options coming up, which are readily available to the parents planning to have kids in the near future. So with this, I would like to end our presentation. Thank you for listening to us.